Thank you everyone for being here today. I'm Dane County Executive Joe Parisi. I'm going to be saying a few words and then we're going to hear from a few speakers representing a few of our partners, and then we will wrap it up by being available for questions. Deaths involving opioids and fentanyl have been steadily increasing in Dane County since 2016. In 2021, 149 people in Dane County passed away due to opioid poisoning, and opioid-related deaths have increased more than 30% in the past 5 years. Meanwhile, overdose and poisoning deaths involving fentanyl are up close to 70% in that same time period. The bottom line is more Dane County residents than ever before are dying from drug poisoning. And just one pill laced with fentanyl or another synthetic opioid can kill. 5 years ago, I directed the county's legal team to file a lawsuit against opioid manufacturers. And as a result, right now, we have $1.6 million of opioid settlement money at work throughout the community for treatment and prevention. We as a community are doing much to address this crisis, but clearly much more needs to happen, and it needs to happen now. In recognition of the continued scourge of the opioids and fentanyl, I'm proposing an additional $740,000 initiative to further address this crisis. This proposal will do the following. In partnership with Safe Communities and Dane County school districts, we'll pilot developmentally appropriate prevention and harm reduction curriculum to better serve elementary through high school students. Using an evidence-based approach, we'll partner with local schools on debuting new educational courses. With community partners, we'll work to increase awareness and community education about the dangers of fentanyl and opiates. We'll partner with community-based organizations to provide widespread distribution of Narcan and fentanyl strips. We will create and fund a dedicated prevention specialist within the Dane County Department of Emergency Management to oversee the development of a Narcan Leave Behind program where EMS agencies can leave Narcan rescue kits at the scene of overdoses. In partnership with Safe Communities, we will embed Dane County recovery coaches within hospitals and potentially the Dane County 911 Center so that when an overdose occurs, an addiction treatment and recovery professional can make quick contact for follow-up help. And we'll create and fund a prevention coordinator at Outreach LGBTQ+ Community Center to serve as a direct liaison to a number of communities, providing more awareness and prevention services to populations disproportionately impacted by overdoses and fentanyl poisoning. Many of our partners in developing and carrying out these new initiatives are with me here today. Our partners include Safe Communities, the African American Opioid Coalition, the Pride in Prevention Coalition, Dane County Senior Focal Points, housing providers, the Recovery Coalition of Dane County School Superintendents, EMS professionals, Dane County Emergency Management, and many others. I want to thank them all for their life-saving work and dedication to reducing and eliminating the needless suffering and loss of life caused by drug overdoses and drug poisoning. I also want to recognize and thank Dane County Supervisors April Kagea and Rick Rose, who are here today, for their partnership and their dedication to putting an end to this crisis. Too many lives have been lost, and far too many of us have been directly or indirectly impacted, or know someone who has been impacted by this tragedy. Today, we say enough is enough. We move forward and we build upon the work already taking place in our community today so that we can make an even greater difference tomorrow. Now we're going to hear from a few of our partners. First, we're going to hear from Dan Olson, who is the Monona Grove School District Superintendent, speaking on behalf of the Dane County School Superintendents.
On behalf of the Dane County School Superintendents, I'd like to thank Dane County Executive Parisi for incorporating prevention resources for schools in his emergency harm reduction and prevention plan. These resources are coming to us at a critical junction. According to the CDC, nationally, teen drug overdose deaths rose sharply in 2020, driven by fentanyl-laced pills. In 2021, 77% of all teen overdose deaths involved fentanyl. As a school community, Dane County superintendents are aware of the deadly threat these substances present to our students and families. Health and wellness is part of our core curriculum across districts, but this new wave of fentanyl-laced opioids calls for a focused harm reduction approach. We also welcome the opportunity to pilot additional evidence-based primary prevention education as an adjunct to our current school offerings. Again, thank you to Dane County Executive Parisi for allocating resources to school districts to address this problem.
Thank you, Dan. We appreciate the partnership of all of our school districts. Next, I'd like to introduce Carla Gaines, who is the co-chair of the African American Opioid Coalition. I've known Carla for many years, and she is a tireless advocate for making our community a better place for everyone, and it's an honor to have her speaking here today.
Thanks to Dane County Executive Joe Parisi for recognizing and addressing the tragic impact of opioid harm on the Black community. The African American Opioid Coalition, a network of African American leaders working to prevent drug harm, founded by Ms. Charlie Daniel, is committed to effective action in saving lives. Our work to date has included coordination of Med Drop Sunday medication, including events at our Black churches, distribution of over 1,000 medication lockboxes to community members, and support for people in recovery seeking housing and jobs. The plan that County Parisi has in announcing today the Emergency Harm Reduction and Prevention Act includes funds that will enable the AAOC to expand the life-saving resources and education we provide to Dane County's African American community. These resources, naloxone, fentanyl test strips, culturally competent harm reduction and prevention education, and recovery supports will be delivered through trusted community institutions, including Black churches, nonprofit organizations, media outlets, and treatment providers, among others. This support comes at a critical time as we work to reverse a deadly trend both in our community at large and in the Black community. While the deadly synthetic opioid fentanyl presents in everything from counterfeit prescription pills and cocaine, is an equal opportunity killer. It is taking a disproportionate amount of Black families. According to a public health Madison-Dane County, the overdose death rate is 3 times higher among Dane County's Black residents than white. We are honored to lead this work and appreciate Dane County Executive Parisi's commitment to addressing drug harm in Dane County's African American community. Thank you, County Exec.
Thank you, Carla. We appreciate you and all of the work that you and so many others are doing in this area. Next up, we're going to hear from Steve Starkey, who is the Executive Director of Outreach. You know, we're really blessed today to have this group of community leaders with us, people who have been on the scene for a long time and have a commitment and a track record of making a difference in people's lives. And Steve is certainly one of those folks. So, Steve? Thank you.
Thank you so much for that introduction, Joe. First, I want to recognize the long-term commitment that Dane County has made to LGBTQ plus people through their support of Outreach LGBTQ plus Community Center and other agencies. I also want to recognize the important partnership Outreach has had with Safe Communities and their excellent work to address substance abuse and the opioid epidemic. Thanks to Dane County Executive Joe Parisi for his commitment to saving LGBTQ plus lives. Funds included in the County Executive's Emergency Harm Reduction and Prevention Act will jumpstart a coalition of organizations and businesses that serve Dane County's LGBTQ plus community, including Outreach, G-Safe, Out Health, Vivant Health, Briar Patch, the African American Opioid Coalition, Public Health Madison and Dane County, and LGBTQ bars and others. 2. Spearhead LGBTQ plus demographic survey to better focus resources. No local data is currently collected on LGBTQ plus substance use and disorders and impacts, even though national data indicate that our population is a very high-risk group. We will also place and maintain overdose AIDS kits, which include free naloxone in clubs, restrooms, recruit partners to distribute naloxone and test strips at appropriate locations. We will also participate in community-wide public education campaigns and identify and deploy strategies to reach at-risk LGBTQ plus youth. The Emergency Harm Reduction and Prevention Act will save lives of LGBTQ plus people. Thank you so much to Dane County and Safe Communities for your leadership on this issue. We look forward to working with you on it.
Thank you, Steve. We appreciate it greatly. Wrapping up today, and then we'll all be available for questions, is Charles Tubbs. Charles Tubbs is a colleague and a friend. He is the director of Dane County Emergency Management, and like too many others, he has been personally touched by the opioid crisis and tragedy. And Charles and his family have chosen to channel their grief in the most positive manner they could come up with, and have been champions for behavioral health and addiction help that has already come to fruition over the last couple of years. And he continues to work both personally and professionally to address this crisis. I have the utmost respect for Charles, and I really appreciate his being with us today.
Good morning, and I'm honored to stand here today and recognize, and my heart is full of great gratitude to look at the superb job and leadership once again displayed by our County Executive Joe Parisi and his staff. No matter what the crisis is, no matter what the emergency is, Joe Parisi has been front and center. I want to thank everyone here today, each and every one of you. I don't have everybody's names, but I want to thank everybody who's involved in this. This is very critical to my heart in moving this situation forward. Our concerns about overdose deaths are real. Over 100,000 people have lost their life, and the number is growing and growing every day. Some people want to take the position, these people are not real approach. But I tell you, they are our children, our brothers, our sisters, moms, dads, friends, and the stranger in the street. They are not addicts, losers, criminals, or throwaway people. These are real live human beings. Facing life struggles and challenges. Yes, we do have some people who are addicted and have suffering from mental health issues, but this is an illness. That's why it should be treated no differently than other illnesses that we deal with. Many victims of overdose never knew that their drug of choice was laced with fentanyl. In some cases, it was a one-time deadly experience. I receive phone calls every day, emails, personal contacts, begging for help for their loved ones. These citizens are lost, confused, sad, the feeling of being a failure, and other terrible things that go through their mind. My assistant, Carrie Maya, and I are honored to have the opportunity to bring such a powerful position to our department to help improve the quality of life and address the critical issues that are robbing our lives of our loved ones. This is a great, powerful piece to the puzzle to addressing this deadly problem facing our communities. We can all do our part. I carry Narcan every day. Where is your Narcan? Where is your Narcan? Every day of my life I carry Narcan. Not to be a hero, but to make a successful attempt to save someone else's life who may be suffering from an overdose. I would recommend, if you do not have this available on your person, in your workplace, or in your home, you change your thoughts now. Fentanyl is everywhere, and it is very, very deadly. My own personal experience, as I told you, I lost my son, as County Executive Joe Parisi said. I tried everything, including the day of his death. I had these in my pocket, and I utilized these in my, 2 of these, and it didn't work at the time. It just was not meant to be. So I've carried it prior to that, and every day since that, and will carry it to the day I get called home. I've been accused at times of having a soft heart. Call me what you want. I do believe good people do bad things, and they should be held accountable for their actions, which includes the opportunity for treatment and a second chance. In closing today, I want to leave you with my motto: as long as there's breath, there's hope. And I want to point out one last thing. Our county executive, Joe Parisi, gets it. Give him a hand. Working together, we will solve this problem. Thank you.
Thank you, Charles. As you can see, this crisis is real. The pain is real. As is the commitment of everyone here and beyond to address this crisis head on. To do everything in our power to ensure that we reach a day when no one has to experience what too many standing here have experienced. Again, I'd like to thank everyone who's here today for your commitment. And we're going to make a difference. Thank you. We'd be happy to answer any questions. We're looking, where is Cheryl? If you want to touch on any of this, you know, or you're saying generally there are a lot of things in the works right now, but if we want someone to speak to the specifics.
I think that's a great question. It is definitely something that we see on a daily basis as a barrier and a struggle with those that we work with in the community, and there isn't a plan in place yet, but we do have committees dedicated to developing a plan and coming up with something solid for Dane County.
Thank you. Yeah, and I think
Tanya Craigie, I'm the Drug Poisoning Prevention Peer Provider Team Manager.
And part of the work that goes on is identifying these gaps and identifying potential solutions as we move forward. Because as you mentioned, there's multi-layers of government, et cetera, and requirements. So as we move forward, we learn something new every day. Other questions? All right, good. Well, thank you everyone for being here. We appreciate it. Thank you all.
3 Now is always on.
Get the Channel 3000 app, activate the push alerts, and we will send you breaking news, traffic, and weather alerts as it happens.
The Channel 3000 app. Get it now.
Powered by News 3 Now.